Lawrence and Pisomera from NR11, and now we are going to perform the unoccupied bed making. An unoccupied bed is made when the client is not confined in bed. And in this bed, all linen beneath the bed spread is fully protected from dust and dirt until the admission of a new patient. Purpose of making an unoccupied bed is first to be ready for the next occupant or patient. Second is prepare the bed for the client's return. Third is to provide a clean and safe environment for the patient. And lastly is to minimize source of infection and skin irritation. So let's begin for the assessment. First, check chart for activity order for patient. So we need to check the chart. Second is assess patient for specific symptoms. Third is check condition of linen on bed. And fourth is check for patient's special needs. So, good morning, ma'am. I am Lawrence Antisomera, your student nurse from Universidad de Manila. I'm going to perform bed making. Is that okay po, ma'am? Okay po, thank you po. May I know your name po, ma'am, and date of birth? Okay po, thank you po. Nice to meet you po, ma'am. The next thing to do is to perform hand hygiene or wash hands. And put on clean gloves or surgical gloves. I explain the procedure to the client, and the next thing to do is provide client privacy by closing the curtain or draw the curtains. Next is to obtain laundry bag or hamper. So this is the laundry bag or hamper. Next is gather linen to be used like bottom sheet, rubber or waterproof sheet, draw sheet, and top sheet and pillowcase. Lastly, obtain other needed items or equipment. So first, we have the bottom sheet, we have the waterproof sheet, draw sheet, top sheet, and last is the pillowcase. And the other equipment that will be needed is paper towel, clean gloves, alcohol. So these are the fresh linen, and these are soiled linen. The next is to assess and assist the client out of the bed. Can you stand up and transfer to the chair if you can? Okay, slowly, and try to observe if you or there will be a feeling of dizziness. If there is, just take some rest instead of standing up and moving around, okay? And the patient can do it. If the patient can do it, then transfer the patient. Assist the patient to the next chair, okay? Assess completely whether the patient can do it in a safe way to avoid patient fall. Next step is you need to raise the bed to a comfortable working height. So let's assume that the bed is in a comfortable height. You have to observe proper body mechanics in doing the procedure to avoid back pain and some certain injuries. This is a good height for me already so that I will not be bending down. Next is to strip the bed. Stripping the bed, you have to untuck the bottom sheet. This is the pillow. Remove the pillowcase. Remove the other equipment. Okay, this is the technique away from you. Fold the dirty linens away from you so that you will not soil your uniform. Remember that when you are removing the soiled linens, pay close attention. Put it in the hamper. Pay close attention. Maybe there are some important things that the patient have left, like jewelry or wallet. Okay, if there are things like that, you have to return to the patient. Remove the gloves after stripping the bed. I already applied the new gloves. So this is the bottom sheet. Bottom sheet. Apply to the center of the bed. So this is the bottom of the bottom sheet, parallel to the bottom edge of the bed. Spread the bottom sheet up to the head of the bed. So this is the fold of the linen. This is the hem side of the linen. So we need to pull the hem side of the linen towards you or towards to the nurse. Carefully. Leave it hanging. So there is another one. So we need to fan fold at the center. So we need to tap at the edge part. So we need to miter in the corner. So from this edge up about 18 inches, lift the bottom sheet and make a triangle. Then tuck. Then pull it back. Then tuck it again. Tuck it very clean, neatly. So after the bottom sheet, next is the rubber or waterproof sheet. So let us assume that this is the waterproof sheet. Place at the center of the bed. Place it where the patient place the lower back. Open from the side. And the other one is to fan fold at the center of the bed. So after that, we will now apply the draw sheet. So as you can see, the bottom sheet, I apply it at the bottom edge of the bed. But this time, the draw sheet will apply edge to edge at the top edge. Open and spread at the bottom edge. This is the center fold of the linen. This is the hem side. Get the hem side. Pull towards you or towards the patient. This one, pull it with carefully. Leave it hanging. This is the other side of the hem. We need to fan fold it at the center of the bed. And the other side also. And then tack the bottom part of this top sheet. Tack it under. Miter the corner. That is the edge. Let us assume that 18 inches here. Lift. Form a triangle or make a triangle. Tuck it under. And pull down this part. We don't need to tuck it the side of this top sheet along with the bottom sheet. The only sheet that we will tuck is the bottom sheet. Next is the blanket. So you can apply other sheet. Apply it edge to edge at the top edge of the bed. Open, spread at the bottom part of the bottom edge of the bed. So this is the center fold of the linen. This is the hem side. So we will get the hem side. Pull towards you. The other hem side fan fold at the center of the bed. At the center of the bed. And the other side also. So, next is tuck it under the bottom part of the blanket. Fix it. Tuck it neatly. Miter the corner about 18 inches. Form a triangle or make a triangle. And tuck it. The portion, leave it hanging freely. So the next thing is move to the other side. So the first thing is we need to get the bottom sheet. So this is the bottom sheet. Tap on the head or top edge the bed. Miter the corner. Make a triangle about 18 inches. Tap it. And leave it hangingly. Tap it the side of the bottom edge. Stretch the bottom sheet. Next is uh, pull the waterproof pad or waterproof sheet. If it's long enough, tuck it under. Next is the top sheet. Pull it. Miter the corner. About 18 inches. Tuck it under. And the side of the top sheet, leave it freely hanging. Next is fold the blanket. Miter the corner. About 18 inches. Make a triangle. Tuck it under. And leave it the side hanging freely. So next is get the pillow and the pillowcase. This is the pillowcase. This is the close edge. Grabs the close edge. Hold it. With your another hand, hold the pillow. Holding this way, grabs the pillow. And make sure that the pillow does not touch your uniform. Our rule is to, this is the open edge of the pillow. Our rule is to away from the door. So this way. This is the open edge. This is an occupied bed. We can make it unoccupied by pull back together the top sheet together with the blanket like this up to the foot part. And fold it like this. So that the patient, when he opts in, he will pull it and cover himself or herself. So this is the unoccupied bed. Evaluate the following criteria: smooth and wrinkle-free surface, low position, and tight corners. Yan, tight corners. And the whole light is placed in appropriate manner. And for the documentation, we need to document the time when the linen changed according to the hospital policies. As of now, as 3 p.m., I already done changing linen or perform an occupied bed making. Good day, everyone. My name is Lawrence Antisamera from NR11 at Universidad de Manila, your student nurse. For today's video, I will be performing bed making. So first, what is bed making? Bed making is a technique of preparing different types of beds for patients that is suitable for his or her position for a particular condition. It is a process of neat and clean bed making for the patient. Occupied bed. An occupied bed is made when the patient is not able to tolerate or not permitted to get out of the bed, or when the patient is already occupied in bed. So what are the purposes of bed making? First is to change wet or soiled beddings or linens for the comfort and safety of the patient. Second is to provide a change of position and to afford an opportunity to inspect the client's body. Third is to minimize source of skin irritation. Fourth is to provide a clean environment for the patient. There are special consideration in bed making. First is, before starting the procedure, see to it that all linen is on hand and arranged according to use. Second is, if the bed is of the high-low type, adjust the height accordingly to prevent having back pain or injuries. Third is to finish one side of the bed at a time. Remember that placement of the rubber sheet will depend upon the client's need and condition. Fourth is apply the principles of body mechanics while making the bed or performing bed making. So, the first thing that we need to do is check the chart for the activity order for the patient. After that, assess the patient for specific symptoms. Third is check condition of linen on bed. And fourth, check for patient's special need. So far, the patient is needs moderate assistance. Then the condition of the linen on bed is not quite mess or dirty so far. So the fifth step is perform hand hygiene or wash your hands. So this is the alcohol. Perform hand hygiene to prevent the spread of microorganisms. Obtain laundry bag or hamper. So this is the laundry bag or hamper. And gather all the equipment that will be needed, like linen, like bottom sheet, rubber sheet, draw sheet, top sheet, and pillowcases. And obtain other needed items or equipment. Good morning, ma'am. I'm Lawrence Ann Pisamera from Universidad de Manila, your student nurse for today. I will be performing bed making or change your linen to a new linen. So, is that okay to you, ma'am? Okay. So, may I know your name, ma'am?
Hilary Claire S. Guevara.
And your birthday?
2010 November.
Okay. Thank you. So, there are three identifiers of the patient. First is the name. Second is the date of birth. Third is the medical record number of the patient. The nurse should use 2 out of 3 identifiers. I already put PPE and I already perform hand hygiene or I already wash my hands. So the next is provide a privacy for the patient. Draw the curtains. Next is to raise the bed to a comfortable working height. So let's assume that the height of the bed is in a comfortable working height. You have to observe proper body mechanics in doing the procedure to avoid back pain and some certain injuries in part of the nurse. So this is the good height for me already so that I will not be bending down. Next is to remove the top bedding. The top bedding composed of the bottom sheet, top sheet, blanket, untuck, remove other equipment or things that attach to the bed. One thing that attached to the bed is the coal light. And loosen the top beddings. Yan. Already loosened the top beddings up to the foot part. And also to the other side. Next is you may need to use some blanket for the patient to cover the patient. So this is the another butt blanket to cover the patient. there are two things. First is to provide privacy for the patient, and second is to provide warmth for the patient. So, Miss Hillary, can you hold this top edge of the blanket? If the patient is unconscious, the nurse should do it for the patient. But my patient is not unconscious, so she could hold the top edge of the blanket. The purpose of the blanket is to cover the patient while I removing the top linen. Hold it and put it to the laundry bag or hamper. So after removing the top linen, um, the next thing that we need to do is to move the patient to the other side so that there is a space that I can change the linen. So, Miss Hillary, um, this is the upper segment, mid segment, and the lower segment. So, I will move the patient from upper segment, the middle segment, and the lower segment. So, we need to lock roll the patient by doing this. This is the foot part of the patient. You need to cross over it. And the one arm of the patient position like this, and the one arm of the patient put in on the chest. On the count of three, Miss Hillary, on the count of three, Miss Hillary, I will roll you on the other side. So, 1, 2, 3. So, remember, do not roll the patient when the side rails are not up. So, ma'am, I will adjust your pillow. Loosen the draw sheet, bottom sheet. Roll and towards to the center of the bed. So, I already touched the soiled linen. So, I need to change my gloves into a new clean gloves. I already put new clean gloves so that when I touch the new linen, I will not contaminate it. So next is the first that we will put at the bed is the bottom sheet. So this is the bottom sheet. Place at the bottom edge of the bed, edge to edge, parallel to the bottom edge of the bed. Spread towards the top edge of the bed. So, this is the hem side. This is the center fold of the linen. So, pull the hem side towards you or towards the patient. Pull carefully. So the another hem side, fan fold at the center of the bed. So we need to miter the corner. This is the corner of the bed, about 18 inches, flip, and make or form a triangle. And tack the portion, leave it hanging, and tack the other side of the bottom edge. Tack it well. Next is the waterproof pad. So this is the waterproof pad. Place it where the patient back place at the center of the bed. Get the hem side and the other hem side fan fold at the center. Next is the top sheet. This is the top sheet. As you can see, the bottom sheet, I already started at the bottom edge of the bed. The top sheet will be placed at the top edge of the bed, edge to edge, parallel to top edge. Spread the top sheet towards the foot part. This is the hem side and this is the center fold of the top sheet. So pull the hem side and the other side pull towards you. Leave it hanging. And the other hem side fan fold towards the center of the bed. Next is miter the corner. This is the corner of the bed, about 18 inches, lift, and make a triangle. Tack it. And the portion, leave it hanging. We don't need to tack the side of the top sheet along with the blanket. The only one that we need to tack in the side is the bottom sheet. Next is the blanket. Place at the top edge of the bed, edge to edge, parallel to the top edge of the bed. Spread towards the foot part. This is the hem side and this is the center fold of the linen or the blanket. Pull towards you or to the nurse the hem side and the other side. Leave it hanging. And the other hem side, fan fold together or towards the center of the bed. Tack at the bottom edge. Carefully and neatly. Miter the corner about 18 inches, leaf, and make or form a triangle. Tack. Tack again the blanket. The portion, leave it hanging. So next is to the other side of the bed. Next is we need to reposition the patient. So before we need that, Miss Hillary, I will put you back on the center of the bed. Okay? So we need to up the side rails on this side where the patient will go or will be placed. Okay. Ano ba? One of his arms on this position and one of his arms on this position. And her foot to cross over. On the count of 3, I will roll you on the other side. 1, 2, 3. Okay? So, make sure that the blanket covers the patient. I will position your pillow. No? So, we need to remove the soiled linens. Roll and fold it together. And move it or put it on the hamper or laundry bag. So, before we put the bottom sheet or the other clean linens, I already touched the soiled linen, so we need to remove gloves and put another clean gloves. So, I already put a new clean gloves. So, next is pull layer by layer. So, we need to pull the bottom sheet. So, we need to miter the corner of the bottom sheet. About 18 inches, leaf, and form a triangle. And tuck it. And the portion, pull down. And the side of the bottom sheet, tuck it together. Next is pull the waterproof pad. If it's long enough, tuck it together along with the bottom sheet. Next is the top sheet. Pull it together. Pull. Miter the corner, about 18 inches, leaf, and make or form a triangle. And tuck it. And the portion pull down. Leave the side of the top sheet, leave it hanging freely. We don't need to tack the side of the top sheet. Next is the blanket. Miter the corner, about 18 inches, leaf, and form a triangle and tack it. The portion, leave it hanging. So next is tack the side. Tack, tack it, tack it. And also to the other side. So next is reposition or put it back to the center of the bed, the patient. So ma'am, and put a new top sheet. And remove the blanket. And move it to, or put it on the hamper. So put a new top sheet and a new blanket. Remove the under blanket by uh, holding this part of, or the top edge of the top sheet and blanket by the patient. Hold it. Put it on the hamper. Tap the both at the foot part of the blanket at the bottom edge of the bed by lifting carefully or gently the mattress. And miter the corner, 18 inches, make a triangle, and then tack it. We don't need to tack the side of the top sheet or the blanket. Leave it hanging. Also on the other side, miter the corner, make a triangle, then tack it, and leave it the side hanging freely. Pillow. Remove the pillowcase. And put the pillowcase at the hamper. And also the pillow, put it on the certain place, appropriate place. Already touch a soil or contaminate pillow. So I need to remove gloves and place a new clean gloves. Get a new pillowcase. So this is the close edge graps. And hold like this. And with your another hand, get the pillow. Make sure that the pillow does not touch your uniform. And put it on the pillow. Grabs the pillow and put the pillowcase. Turn upside down to properly put the pillowcase. After putting the pillowcase, one rule is the open edge of this pillowcase is away from the door. So this is away. Here, the open edge of the pillow away from the door. The last thing we need to do is to ensure the patient's safety. We need to up the side rails on the both sides of the bed. So let's assume that the side rails is already up and adjust the bed position to a comfortable position. Is that okay, ma'am? The height of the bed? Is it comfortable, ma'am? Okay po, thank you po. So, for the evaluation, evaluate the following criteria. First is the smooth, wrinkle-free surface. As you can see, all the linens are smooth and wrinkle-free surface. Tight corners, already tuck it very well, all the linens. Third is low position of the bed. So let's assume that the bed is in a low position or a comfortable position for the patient. Lastly is the cold light placed in appropriate place or the on the side of the bed where the patient can get the cold light. For the documentation, document the linen time where bed making performed according to the hospital policy. As of 4:15, I already done changing new linens and already done perform bed making.